We do have a list of questions from yesterday, and I just was scrolling through all the questions from today. And we can certainly go through those. I would rather start, however, with anything burning that you guys have from the last day and a half of presentations. And I'm sure that you still, or questions that we didn't answer that you are still wanting to know more about. So I'm going to open it up either through the chat or through unmuting yourself to go ahead and ask questions, and we can go ahead and get started when you guys are ready.
Rick, this is Dawn Carter. What kind of consultations will be available to MRSS teams when they're starting out? For example, the grant-funded programs had access to SARA. So I was wondering, will we have those kinds of consultations available, or will it be through you and the new CCOE?
Well, you know, Dawn, when you're as talented as you are, your agency would never need additional consultation.
And your eyes are what color?
You are funny.
So what's going to happen moving forward? You know, we certainly would not be able to provide consultation for every new program, excuse me, like we did with the pilot, and that was a very specialized setup for that. We will be doing regular learning communities. We will be doing regular, you know, I think Beth Boyle shared the case consultation kind of approach. We'll be doing that as well. There will be some limited times for coaching for specific programs. I mean, we will still have Sarah involved. We'll still have Chris Morano involved. But because we're anticipating a fairly large amount of growth, there's no way that we could do the kind of weekly or every other weekly consultation they were giving now. However, the COE will be available for any kind of implementation assistance. And by the COE, I mean also, you know, we'll be contracting with Sarah and Chris and others, Jeff Vanderplug as well, and others on the call today to push out a lot of the good information that you're going to need to get started, as well as anything ongoing through our learning communities. So it will be limited, Don, in terms of like anything weekly or every other weekly consultation.
Looks like we have another question in the chat. Does OhioMHAS have a program for one to be a certified MRSS paraprofessional?
This is Wilma. No, we do not. What we do have is a curriculum that parents needs to go through to get certified as a parent peer supporter. You can get that through either FEDLA, which is through Union County, or you can utilize the training also that NAMI of Ohio have put together for parent peer support training. And for the young adult peer support training for youth, it should be out sometime in the beginning of January, and you'll be able to utilize it.
Rick, I have another question. It's Dawn.
Hey, Dawn, go ahead.
For certification for the MRSS, will we be certified under crisis services with OhioMHAS or under home-based services, or will there be a new certification for agencies?
That's a great question. Wilma, do you happen to know the answer to that?
I think the way we've discussed it is that if your agency have those 5 service, you've been certified for those 5 services, and you request to do MRSS and show that you can set it up, then the licensure and certification people will give you a special certification for MRSS. But it's not IHBT or anything else like that. You have to, your agency have to have the general mental health. I'm not gonna remember them all. Peer support,
I'm pulling it up right now, Wilma. I'm pulling it up. So, it's in the rule in terms of what you need to be certified for. And if I scroll fast enough, Don, I'll get there, but it's not IHBT. And I'm not even sure that you have to be certified in crisis either.
No, you don't.
It's general services, SUD case management, peer recovery services, community, CPST, and then TBS.
I'll look in the rule then. I missed it in the rule. Thanks.
It's in D of the rule.
Hi, Rick. This is Beth Gracie from Summit County. How are you?
Good. How are you doing, Beth?
Good. I just had a quick question. I think quick. If there are 2 agencies in our area and our community that are interested in providing the MRSS services, do you know how that would work if more than one agency is interested in providing that service?
I think it's a great question, Beth. I'll answer it in a couple different ways. Number one, certainly this is, as I believe it was shared yesterday, this is still an any willing provider service. So providers could choose to offer the service. I think the question for the community is, the question for providers is, can you do this service as an any willing provider through Medicaid alone? Or do you need community support to do that? That's one question. From a community standpoint, I think it would be possibly quite confusing to have more than one, depending on the size of the community MRSS program, as well as coordinating that with whoever's going to be the centralized on call as well, like who you want to call in that community to transfer the MRSS call. We're recommending that communities get together, whether it's local boards, FCFCs, child serving agents, departments, and think through as a community what is the best plan to move forward. We're assuming that most MRSS programs will need additional funding to be sustainable, and that additional funding normally would come through the local community. So that's where communities would get a little bit more say in what would be implemented in their community. There's no restriction, but community planning would be critical. Sorry.
I would add to that. You really should be working with, like what Rick said, your board, your FCFC, but you should also think about those statistics that was presented earlier, and that Jeff Vandenbloot talked about for Ohio. We're looking at, in the beginning, 7 out of every 1,000 kids in your community probably is going to be families going to be asking for services. So how many kids is that for your county? It should help you to determine whether or not one agency or 2 agencies need to be servicing your county. Now, so think about that as well.
I think Christina had a follow-up So who would I envision, or who do we envision the undertaker of putting those meetings together? The provider, question mark. I don't know that there's a formula for that. Okay. I think that the hub of any community right now is usually FCFC. They have on their, executive committee, all the child serving systems. I mean, in my mind, I probably would start there. The other place, the other sensible place is at the Mental Health and Addiction Board. And certainly there could be communication with providers and boards and FCFCs, but whatever the decision is, it needs to be coordinated. And if you're looking for somebody more neutral to coordinate, FCFCs might be the right place to go.
I would also say that when we started with the 2 regions, we started with the boards and the FCFCs, and then before they even decided on which agencies, they put together, and you've heard Heather and Beth both talk about these change teams that they set up. And the change team somewhat talked about, because they had people, FCFC, they had child welfare, they had a number of people on those groups. And they kind of talked a little bit about what the needs were and stuff. And it helped some. Now, it wasn't a final sender. And then a couple of the board areas, what they did was to send out an RFP. Now, and based on how people answered the RFP, made the determination of which providers they went with.
That might be a really smart way to go, as a community in terms of, putting out an RFP. Danielle asks, for rural areas, when the weather is bad and road conditions are unsafe, what do you recommend? I recommend AAA and kitty litter.
One of the things that is part of the first of all, in the tab, the Wraparound Ohio tab for MRSS, you're seeing there the standards, and it's even written in the standards that we hope that you're supposed to get there within 60 minutes. But if weather is bad, ice on the road, things like that happen, it means you can't get there. You just have to note, you have to document it. And you won't be jeopardized because of that. But the standards go into a little bit of detail about that.
Thank you.
I mean, bad weather is a thing, right? I mean, You can only do what you can do, and you have to be safe. And we get some interesting weather in Ohio, and it's variable.
We had it today. There was flooding. And so our MRSS worker couldn't get to the home because the home around the area was completely flooded.
Oh, wow.
Yes. So that's why I'm bringing it up.
Where are you? So I won't have to get there.
We're in Wood County, so just don't come over in this area. It's supposed to flood.
That's right.
Today.
They said that Northwest region was going to get hit badly today.
It sure.
So kitty litter and maybe I don't know, a full raft of some kind where you could just kind of
I would think that if it's
find your way to the home.
I would think that if it's an emergency situation or something where the triage indicates that somebody needs to go out right away, then that would have to be referred to law enforcement to respond, I would think, because they would have more capability to respond in that situation and those road conditions, if anybody could.
And your conversation with the family as you're going, and you're being able to say to them, and you can't get there, you try to use that time period to de-escalate some of the stuff, and then that'll help you tell whether law enforcement or someone needs to assist and get in there to help the family.
I might also include law enforcement in a case like that of, hey, how are you going to get there? And can I follow you? Or something like that. You know, do they know a different route? Calling the family, do they know a long way around to get to their home? You know, maybe something like that. I actually had this happen to me this past winter on a run where I was the responder on, and I tried to leave. I got maybe 1/10 of the mile away from my house. And I was like, there's no way. There's no way. I turned around and went home. And so I called the officer and I called the family and offered to phone de-escalate, offered to do a video session if they thought that would be helpful. We ended up doing phone intervention in that case. But I mean, that's a real thing. I don't want anybody putting their life in danger because that's not going to help anybody either. So, you know, our safety is of equal importance. And so that's what we would do. We would do phone intervention. And an aside, I did not get paid for that shift because I turned down a run. So that's also how we do it. I was paid to do a service and I took it. That was my decision that I couldn't safely make it. But I knew that meant I was forfeiting my payment because I didn't do the service. Does that make sense? So that's the other part of that you have to consider, because if I'm being paid to be on standby and I determine I can't in fact leave, then that means I don't get paid.
Right. While for Medicaid, once you turned around and went back and made that phone call and did it telephonically or video, they would have paid for it. They would pay for it.
Yeah, that's what he ended up doing. We kind of tried to problem solve a little bit of how to get there, but he ended up doing stuff over the phone with them because it wasn't an immediate safety, things like that. So he was able to do some stuff over the phone.
Yeah.
Rick, I had a thought about Dawn's question earlier and about the question about the convener around these conversations. And I just wanted to, as somebody who is a former FCFC person, I really think it's important for communities to think about MRSS not as a mental health service, but as it is a mental health service, but it's also a gateway, a doorway into the system of care. And that system of care involves lots and lots of agencies. And I think if you frame it as a doorway or a gateway for the system of care, then it invites conversation among all of the key partners in a system of care, as you mentioned, with family and children first, but not every community has the same degree of engagement with family and children first. But I do think that inviting partners in, not to talk about this mental health service, but about this, wraparound is a gateway to the system of care for kids with very high needs. MRSS moves the intervention further away from the edge of the cliff than wraparound. And so it really is more of a prevention effort for all of the systems in the system of care. So I think if whoever is taking the lead, and it's probably the boards, mental health and recovery boards, if they think about it that way, it invites a different conversation.
That's also the reason why we invited Dr. Mandershine, because we wanted to start this off with people thinking about this as community, not as this is a behavioral health care services. It's what is the community saying? How do we see ourselves as part of community, which is systems of care,
Thanks, Ellie. That was very helpful. Other questions? Sarah, if you're on the line, you looks like you chatted nationally. Some locations have used subcontracting to allow for a centralized hub, but more than one provider serving the region. Could you expand on that a little bit?
Well, I could try, but there's often, multiple folks who might be qualified or in your case, certified to be able to provide a service. But if you're from the family, like who am I calling when? So what I have seen done is partnerships developed between agencies, with perhaps one agency taking a lead, which might be the biggest one, or it might be the smallest one, but they become sort of the holder of the model, and then subcontracting out to other agencies, and it could be to serve, if you're in a city, to serve a portion of the city, maybe certain neighborhoods or certain sections, or if it was a larger area, maybe it's certain towns, or like in the rural area, or whatever it might be. But some of the partnerships have been pretty creative, and it allows for families to have a less confusing experience. Yeah, I mean, I guess it's, predominantly it comes down to that sort of a more tailored approach to communities, but it would involve, which sometimes is unusual, to do partnerships between providers. And so everybody benefits from it, but it maybe is an unusual way to look at it. It's worked out pretty well in some areas, though. I myself happen to have a subcontractor who provides services. I mean, I have a number of towns, but who provides services in one of my, a couple towns.
How do you guys get reimbursed then? Or how do they get reimbursed?
It could be, and again, it's sort of would vary. It could be that an agency does direct billing for the services that they provide. It could be, I mean, that would probably be what it would be in your case with boards. It could be that the money might go to, not to be presumptive, it sounds a little callous, but to one of the agencies, and then a certain portion of payments gets made out to anybody who's subcontracting. Or maybe it's directly from the board down to each of the providers. But I think the biggest thing is there might be one centralizing hub. So when families are calling, they don't necessarily need to know the agency, they're just calling. And then based on sort of background rules is who is responding to the family immediately. I don't know if that helped at all, but that's.
No, that was helpful. Beth has a follow-up question, Sarah. Is the hotline set up similarly?
No.
It's just different in every state, and I think Wilma spoke to this. I feel like it was yesterday, maybe, about Ohio's efforts to figure out what to do about that piece. It is a best practice to have, like a centralizing number, so it doesn't matter if a family is crossing a county line, or maybe their kid goes to school in one region, but they live in another region. Just when anybody needs help, they call and a service is deployed immediately. But different states do it differently. I don't know if Wilma wanted to say anything more, but that was something I might have to say.
No.
Okay.
Shows my frustration of that topic.
It works like, I think Jeff.
Sorry, Wilma. I was just curious.
Jeff showed some data yesterday, which I think is pretty compelling, which is that at least in the state that I live in, and we provide services, and there was a centralized number implemented. He would know it better than me, even though I was there, I don't know, 10 years ago, some huge amount of years ago. And the volume went up overnight by basically double, and it sustained its growth for a number of years. It's like smaller growth now, but it still continues to happen. And if I had to say the game changer in terms of kids getting served, more and more kids getting served, it was that easy access number. I mean, and a lot of standards around, if the number says to go mobile, we go mobile, and that's just the way it is.
Someone just asked the question, will 988 number come into play with this? Okay, that's the frustration. It's what Dr. Mendershide said yesterday. 988 will set up a number. What 988 system does not do, there's a bunch of conditions that needs to be put into play, because that means 988 need to know where all the MRSS providers are, know how to connect with them. They need to know when one drop off and when another one drops on. Then there's a whole bunch of pieces that connecting to the local community piece that 988 is not set up for. To give everybody the most, I think, the example that will make for you to understand it better than anything else, 988 is set up where, in Ohio, where it goes off of area codes. My area code, there nationally, that's how it is. My area code is 678. It's Georgia, it's Atlanta. If I called and I live here in Columbus and say I need some help, it would route that phone call to Atlanta, Georgia. Then Atlanta, Georgia, I would have to tell my story to and find out that, oh my God, I'm talking to Georgia. You're not in Ohio? Then they would say, oh, you're in Ohio? We need to ship you to Ohio. And then they would click on somebody in Ohio. And then I have to tell my story all the way back over again. And then they would try to figure out, okay, is there an MRSS provider in Columbus or nearby? Where are we sending this person? By then, a good hour probably not gone by. So it's minute but big problems, huge problems.
And then that will be the last time that family calls, Wilma.
There you
That will
go.
be the last time they call. And that's my concern, one of my concerns about it.
Yep. So it has some drawbacks that we need to figure out. And so in Ohio, what we really want to do is to set up a way in which we can have a call center that's for MRSS. I don't care that we use the 988 number and that some kind of way that transfer over to this call center. And then we can take care of all of that connected piece and all of that. But it's a fight, all y'all. It's a fight to be able to get there. And we're going to lose families. No ifs, ands, ands about it. We're going to lose families the way it's set up right now for 988.
Well, I mean, even the way right now, we're a national lifeline provider, like I mentioned earlier. And, we occasionally get callers who are very frustrated that, I'm in Pennsylvania. Why am I talking to Claremont County, Ohio? And those aren't even like imminent danger kinds of situations oftentimes. It's about our ability to even get them resources for their local resources. It's not as easy as you would think. I'm sure everybody on here knows, just to Google and find out. We just have a question the other day. It was a person was in Columbus. Does Columbus have MRSS? Gosh, I would think so, but I don't know. And I'm Googling the phone number and trying to find it and find who's the provider. Who do I connect them to? So it's already an issue, and people are frustrated when that happens because they assume that if we're part of this network, then we know all of this, right? And
that's why you need a call center. Could be a coordinating body that stay on top of all of that, including the data around it, the benchmarks that we even set up benchmarks for the call center, because triage is part of MRSS, and it's not as simple as just having a 988 number. It's all I'm saying.
Kathleen says, she's trying to help Wilma's blood pressure. It would be great if we could ping the cell phone location of the closest MRSS provider to the family calling.
And 911 has that, but 988 doesn't. And they're telling us it's going to take anywhere from 3 to 5 years to be able to get that. It has to go through some committee in Washington, then it has to go through the hands of all of the House and the Senate for that to be approved.
So Kathleen,
we see how that's working.
Kathleen, if that's already been considered, we appreciate your comment. That did not help with Wilma's blood pressure.
But there was another message in there. But that is exactly where we want to go, Kathleen, that it would ping to the cell phone. Because what's the percentage of people that's using their cell phones now, Sarah?
80% of Lifeline calls, I mean, Kathy can attest to this, are cell phone based. And then the other piece of it that I thought was interesting was that 10% of all callers into the Lifeline nationally have an out of state phone number, from a cell phone number from where they actually live. So that's an average, but you know, if you look at it for us, 10% of, I mean, 10% of all families would not be met with success right now who need to access MRSS through the 988 route.
And that doesn't even capture, Sarah, the ones that aren't out of state, but on the other side of the state. You know, like when I call from Columbus, they would still count that as within the state, but I'm no help to that family, you know? Not really, not for MRSS. Do you know what I mean? So I know
so these are real problems, and you know, these are things to be resolved as we move forward. And I appreciate the richness of the discussion, and we have other questions. Jamie asks, how do you approach a community that has 3 counties in one city and only 2 of the 3 counties offer MRSS services? What city is that?
We have that in our area. So you can go ahead and give your example and I'll tell you what we do about it.
Columbus has it too, Rick.
Okay.
It's
so
Fostoria, Ohio. Fostoria, Ohio has Wood County, Hancock County, and Seneca County. And Wood and Hancock
Loveland,
are the ones
Ohio
that offer
has
it.
Hamilton, Warren, and Claremont. And so what we do is when, no matter who's calling from that city, and for us, for example, right now, I'm sitting in my zip code is Cincinnati, and I'm in Claremont County. And so I'm not in Hamilton County, I'm in Claremont County. That is up to us as the local responder answering to know that and to verify are you in Claremont County? If they call and say, I'm in Cincinnati, are you in Claremont County? Yeah, I'm in New Union Township, or yeah, I'm in Eastgate, or Loveland. Where in Loveland are you? Are you within Claremont? We have had police officers call and say, can I walk this guy over 2 blocks and then you'll come? Yes.
That's absolutely true.
And we do it. Walk them over a few blocks, get in Claremont County, and we will come do the assessment.
Yep.
We can't leave our county is how we operate it, and have to ask a lot of questions and say, I'm sorry, that service isn't available where you live. How else could I help you?
What I need to figure out, and this is a question that we need to ask Medicaid, is the child is Medicaid eligible. And the closest MRSS to them is right down the street. Like for me, I can cross the street and I'm in another county. Okay. How would Medicaid, you need to label that because the school system is going to refer to where there's an MRSS service, but the school system may be in another county where there's not MRSS. So I need to ask Medicaid, how would people label that?
If it's in Ohio, it doesn't matter. It's billed through the NPI number of the provider and the agency. So
it won't matter as long as they have Medicaid. They're Medicaid eligible.
That's right.
I think the issue becomes not Medicaid, but the role of the county board or who else is providing the additional cost that Medicaid doesn't cover. So I'm in Wayne County, but I know that we have kids who attend specialized alternative schools in Medina County, and we don't have MRSS yet, but we have mobile crisis. I can't send my mobile crisis team, even though this kid is a resident of Worcester, into Medina County to deal with that situation. So I would think it would be the same thing, because the cost of our mobile crisis services is not totally and completely covered by Medicaid. So I have to think about all my stakeholders and not of payment and not just
Yeah.
Medicaid.
And
I was
so
thinking
they,
that too, just we were talking. Sorry, guys.
so having the conversations across the counties become very important in your area then, because you need to think about, okay, what part of this service for this child is not covered? And would that the board in Medina County Board pay whatever that cost is? See what I'm saying?
Yeah, it's tricky.
Yeah, but that's
I think
a
we're
great,
back in a situation where we're asking the boards to pay for this service, and it's not inexpensive, especially standby time. But I know you're not talking about that necessarily, but I think that's tough.
yeah.
It is tough.
Yeah, I think, I think what you guys are all getting at is the implementation of this in particular is so tricky.
Well, let me also say this. That's exactly why certain counties have decided to partner when it comes to MRSS. I mean, you heard today Coleman is doing Allen, Auglaize, Hardin, but they're also doing Putnam. So that board has contracted for that service to come to their community versus them having an MRSS site right there in that community. Okay. Same thing in Southwest Ohio. Butler County Behavioral Health, the boards of Warren Clinton, the board of Butler and Preble County have decided to contract with one agency. So
Right.
that's why this is not an issue of just saying what provider can do this. That's why the boards and the family children first folks have to be involved in this, because you need to look at it as a bigger systems issue as well too.
Yeah.
I wonder if that's the role of an agency, or what the role of an agency is, and what's the role of OhioMHAS in talking with the boards about these issues.
Huh.
Well, I know when we got started, the board, OhioMHAS had some of these conversations with the boards. And that's why we ended up with regions. I'm gonna give you another good example for the grants that we got. These latest ones are 8. I mean, we wrote in the RFP that it could be multiple boards. Start having conversation with us. So we ended up with Athens, Houghton, Benton, and Gallia, Jackson, Meigs coming together as 2 boards, 6 different counties, and trying to think through how they're going to do this.
I'm wondering, I know it's way too soon, but I'm wondering if the new regional liaison positions might play a role in some of this.
That would be good.
I mean, you're asking questions, Dawn, and everybody that, really promotes a lot of thinking on our part as well. I mean, I think there's a lot of things that are still unresolved that we're resolving. So these are great questions. We have a few more questions. Vince writes, so a provider engages in a crisis service for the family, deems it should be MRSS. CANS is completed either by the provider or the local CME. Does the start date of the OhioRISE Medicaid enrollment go to the initial crisis intervention? And how long is expected the turnaround around time for eligibility determination? It's a great question, Vince. And if Medicaid were on the line right now, I'm sure they could answer that question. I'm not going there because I think that's a complicated question. Does anybody feel comfortable enough answering that?
I mean, it depends on how they define what the first billable service is. If the mobile response is the first billable service, and that's going to be your start date.
I wonder
Right.
too, like like there's Ohio Rise and then there's MRSS. And then there's Ohio Rise that MRSS is available under, but then there's MRSS as its own standalone. So I don't know if like it's confusing the two together. Like you don't have to have Ohio Rise to utilize MRSS. Is that, Vince? I don't, you might have to clarify like exactly
Yeah,
what.
it's probably a question, probably too deep in the weeds.
Well, no, it's a good question. It's just like filtering through like which kind of path are you thinking? Because Ohio Rise and MRSS are two different things. It's just that Ohio Rise incorporates MRSS as a service availability. Do you know what I mean?
Yeah, that helps clarify some things. I was just thinking of staffing and how you have a team and how do you get anything, that person goes out on call.
Yeah.
But then if I have a separate MRSS team, then that's different. And then when does that start with that funding stream and things like that? Because it's definitely a different rate than we would get for just going out on call. It just starts into a whole new, phase of, I call it the crisis phase. You know what I mean? That first 72, all the way up to 6 weeks, and then you can jump into other services like
if the child is Medicaid eligible and Ohio Rise kicks in immediately for the initial visit.
Right. Yeah, I understand about that new case that comes in, you know what I mean? Maybe not even with the provider. We were just asked by our board to go help this family out, and then how that kind of plays out.
Explain more, Vince.
No, like for example, like who if we go out tonight on a case and we begin our crisis service, they're Medicaid but not enrolled in anything. Those will be typical cases sometimes we would get. How would you then with the CME, then because you can only, as the provider, you can't be the CME. I'm assuming the CME does the cans, who will then turn that into if it's Ohio Rise, it'll be, Aetna turning that, or whatever provider's doing the CME turning the cans into the Aetna to open them up for Ohio Rise. You know what I'm saying? Like just how that all starts. So initially it starts by probably your own.
I think that's, from my conversations with Medicaid, this is exactly the reason why they backed up from January to July.
Okay.
Because they're having to figure out all that coding and all of that, how stuff kick in and all of that. And that's what they're working on now. But their goal, all I can tell you is what their goal is. If you got a call and you went this evening, the goal is that when you see that family, that initial, it will kick in immediately. Okay. So there's something you would have to do. I don't know what that something is yet.
Okay.
Okay. To click into some type of computer system that will make for you to getting paid at that rate for that initial visit. Okay.
Gotcha.
We will definitely up-level the question to Medicaid just to make sure we're saying it right. And, I actually would have to refer to all the PowerPoints they put out on Ohio Rise to answer the question. It's not simple.
Maybe it's the goal for them is clarify that as we get closer.
Right. And they have said to us, just like we have the standards draft form, and they're going to develop something like that as well that will tell you exactly how it'll be written out, how you're going to do it now, and they'll have a training once they figure all that parts out.
Yeah.
Okay.
So, and Vince, if we can, if they answer the question with complete clarity now, we'll be happy to post it.
And that's not my expectation.
Well, no, they might. I mean, I think they're really on top of it. I'm just not feeling comfortable enough. And I think, we can answer like Wilma's answering bits and pieces of it for sure. I think you're needing that. You're wanting the total answer about how it all is going to work. And I think they do in their minds know what that's going to be. So let's see if they can answer.
Thanks.
Yeah. Christina says, on that note, will we have a master list of providers? Christine, that's a great point, and I think that, yes, for sure, we will have a master list of providers on our website, and I believe that master list probably, Wilma, should be on the OhioMHAS website.
Yeah, in fact, I have been meeting with all of the new providers. I'll have my last one next week. I haven't put it out there yet because I had all the boards, but not all of the providers. So once I get done with this last board meeting with their provider, I will be able to put the list out there on our website. It'll have the board as well as the provider so people know exactly what board is in. Because if I just put up provider Coleman is in Allen, Auglaize, Hardin, and Putnam, Stark, Trumbull, and Portage. So I can't just put the name of the provider agency almost. That's why I'm putting the board and the county that they're with as well.
Yeah, that's great.
Okay.
All right, we're getting on here. I don't see any brand new questions. Do you guys have any other questions that you wanted to voice?
Did you say anything, Rick, about when the trainings are going to be?
So let me see if I can pull it up.
While you're doing that, I'll talk a little bit about the draft benchmarks.
Thanks.
We didn't say anything about that
That's
as
a
well.
deal.
We have, based off of the work from the original providers and looking at the work across some of the other states, we have developed some initial benchmarks. They're also out there on the website, the Wraparound Ohio MRSS tab website. You need to be taking a look at them and start seeing where you are as it relates to it, so that it'll give you a good place to see how and what you need to be doing, okay? As well as we have out there an assessment, a self-assessment tool for providers that list out everything that providers said they needed to be working on as they were doing MRSS. So that's another good way of you looking at yourself and see where you are. There you go, Rick.
Okay, thank you. So, I mean, I think it also, as it relates to some of Dawn's questions and Vince's questions, we do have a cadre of folks available beginning now to help sites think through this, either whether it's implementation or those other questions. So don't hesitate to get a hold of us at the center, and you can use my email as a starting place so that we can provide you what you need and get answers to the questions you have about how do we implement this darn thing. It sounds exciting to us, but right. So there'll be the benchmarks, there'll be, site assessment information for you in terms of what do you need to have to be, to get ready. And the trainings that are available for the fall are listed here, and they're also in your chat box. And they'll be posted on the MRSS website if they aren't already. But we'll have our first core training days on October 25th and 26th. I put Sarah Becker and my name down, but mostly it'll be Sarah Becker. We're excited about that. But it'll be on the first day, it will be the model training itself. The second day will be the safety planning, crisis de-escalation stabilization component of MRSS. We ask that you register. There's the links. We will give you CEUs for both days if you need them. We're going to have a supervisor.
Is this in the agenda, Rick? Do we have this already, the links to register?
It's if you have it in I put it in the chat yesterday and today. I'll tell you what I'll do though, Kathy. Because I
When I
care.
opened it up, Rick, it opened up something other else. It didn't
You're
open
saying
up
it
this
doesn't, the
here.
links don't work?
Yeah, it didn't work for me.
Oh, the first one was a screw up, so don't even look at that.
Oh, okay.
The second
They did.
link worked.
They
The
did
second
work for
one
me.
works,
Okay.
thank you. Yeah, I messed up on the first one. I attached the wrong file. But thank you for pointing out my ineptitudes in
But
front
we
of
can
80
put this,
people.
we can put this on the MRSS tab, website tab as well, Rick, right?
Oh, yeah. And I'll
Yeah.
tell you what I'm going to do is I have the registration emails for everybody. I'll send it to everybody's email.
Good.
Okay?
Thank you.
So-
And Wilma, oh, sorry. Oh, go ahead, Rick.
No, that's it. I just wanted to point out these are the training dates. Go ahead.
I just wanted to clarify too, the benchmarks aren't going to be live until we have the new tools that are live. So that will not be this fall.
Okay.
Because each benchmark question is aligned with a question in the new tool and formatted that way. So, I mean, there are similar questions in the current tools that you can use to kind of look, and definitely look at it to see, you know, what the benchmarks are and, you know, expectations. But until we have the new tool live, we can't use the benchmarks yet, so.
Okay, thank you. I have.
Stacy, I didn't,
Go ahead.
go ahead. I'm sorry, Rick. Go
I
ahead.
was just going to answer Patty's question. Ohio Rise related question. Will there be a wraparound training in the upcoming months? Yes, there will be. There will be probably 2 sets also. And we're just scheduling them right now.
And Stacy, do you have some dates for the training for the for folks around the evaluation piece?
The current tool, yeah, I know we wanted to shoot for October. So I wanted to touch base with you and probably kind of look at the calendar to see when that would work. We just had to wait until the contract was signed before we could set up things like that yet. So I'll touch base with you on.
Okay. So we'll get that, we'll have to get that out to everybody as well.
Yeah, because we will also have to change the current platform of Snap, and I need to touch base with Claire how to add our additional counties and how to add our additional providers. So until that is up and live, I wouldn't want to train somebody on it and then them not be able to use it as well. So, but October would be the short answer.
Okay.
And I think the final chat is that Christina apologizes for contributing to any raising your blood pressure, Wilma.
Okay.
And everybody is signing off. So any other questions for the good of the cause or any other comments that we wanted to share? We will go through each of the questions. There's a number of them from yesterday that I know that we tackled a bunch of them yesterday, but I think there was some very good questions related to, the licensure and texting and those kinds of things, very specific questions that we will go ahead and create an FAQ and post that and look for that on our wraparound MRSS page. And I have all your emails now, so you are now on my email list.
Thanks, everybody.
Thank you, guys.
Yes, thank you, everyone.